Why we should breastfeed. According to the American Academy of Pediatrics, breastfeeding is a natural and beneficial sort of nutrition and provides the healthiest start for an infant. In addition to nutritional benefits, breastfeeding promotes a unique and emotional connection between the mother and the baby. In the policy statement, Breastfeeding and the Use of Human Milk, published in the March 2012 issue of Pediatrics, the American Academy of Pediatrics reaffirms its recommendation of exclusive breastfeeding for the first 6 months of the baby's life, followed by breastfeeding in combination with the inclusion and introduction of complementary foods until at least 12 months of age, and continuation of breastfeeding as long as mutually desired by the mother and baby. It is important for all nurses and healthcare workers who work in a maternal childbirth setting to be aware of these policies and to be able to implement them. I've worked in the NICU nursery for 2 years, and so I had to become very familiar with these. Breastfeeding is a very, very important part of giving the best possible care to our new mothers and babies. And we're now going to review why this is so medically important and review the parts that the nurses and other healthcare workers are going to play in this important area of patient care. So why does breastfeeding matter, and why is it important that we do this? Well, it's important for the mother's health because it's going to help promote bonding between her and the baby. We're going to start out giving skin to skin with the mother after the baby is born. According to Crenshaw in 2014, an essential practice for safe and healthy birth is to keep mothers and babies together and ensure unlimited opportunities for skin-to-skin care and breastfeeding. This is because having the mothers and babies in the same room is going to promote the availability of the breast milk and increase the availability of the mother to the baby. It's also going to help prevent certain maternal health problems, such as cervical cancer or ovarian cancer. Also, it will promote weight loss after childbirth if the mother is exclusively breastfeeding because it will burn up to 500 calories per day. We need to make sure that we teach the mother proper health and nutrition and hydration for this so that we can make sure that she's not starving her own body. Now, why is it important for the newborn? Well, as you know, when babies are born, they do not have an immune system of their own, so it is important that if the mother gives the breast milk, then she's going to be passing off antibodies of her own to the baby to give the baby a temporary immune system during the time that it's building its own immune system. And this is really, really important for the baby. Also, the milk is going to adapt at different times of the baby's life according to season, the temperature outside, the baby's age, the time of day even. So breast milk will actually adjust itself to the baby's needs. Also, fathers need to be included in this process as well. In a study by Brown and Davies in 2014, fathers felt that the fathers were encouraging of breastfeeding but wanted to be able to support their partner. However, they often felt left out of the breastfeeding relationship and helpless to support their partner at this time. Many reported being excluded from antenatal breastfeeding education or being considered unimportant in the postnatal support. Men wanted more information about breastfeeding to be directed towards them alongside ideas about how they could practically support their partner. This is a good thing, and we need to be encouraging the paternal involvement because they need to be able to be there to support the mothers. So why do nurses need to be involved in this process, and why are we a part of this? Well, as always, we are a key role in the education of our patients. So it's very important that we are there in particular to help the mothers learn the correct way to breastfeed their babies. According to Surtees and Keller in 2011, correct latching techniques are one of the most important skills we can teach our mothers. Signs that a good attachment have been made are that the baby's nose is free from the breast, the baby's chin is firmly pressed against the breast, the baby has round cheeks, and if any areola is visible, it should be more above the top lip than the bottom lip. So giving the mother the correct skills on knowing how to correctly feed her baby is very key to successful breastfeeding. Also, we need to know who is available to support the mothers in their breastfeeding. So do we need to consult a lactation consultant if we have one? Or what are handouts and education materials that we can give to the mother? Also, because it is best practice, we need to be there to encourage our patients. If the American Academy of Pediatrics and the World Health Organization recommend this as strongly as they do, then we know it's important for our patients, and we know that it is best for our patients. So therefore, we need to make sure that it is done. In conclusion, we really do know that this is the best choice for our patients. And we're going to close with a quote from the World Health Organization. Breastfeeding is the normal way of providing young infants with the nutrients they need for healthy growth and development. Virtually all mothers can breastfeed, provided they have accurate information and the support of their family, the health system, and society at large. This is true, and it is our job as nurses and healthcare workers to be there for our patients and give them the best chance of success possible.